So we are group one, and this is our sensor-coupled drug release mechanism as a solution to overactive bladder. So overactive bladder is a condition where patients suffer from infrequent urination, need to urinate, and detrusor muscle spasms in the bladder. And in the U.S. alone, 33 million people suffer from it. It is more common in older patients, people that smoke, or people with obesity, and it is more common in women. The current condition or the current solutions revolve around dietary changes, exercise, fluid intake, medication, or even electrical nerve stimulation, but there are currently no long term solutions.
Whether the sudden urinary urgency occurs during sleep, an exam, or an important meeting at work, it is clear that OAB can interrupt daily life. Some people may actually have to plan their whole day around it, so whether they're reducing fluid intake or only going places where bathrooms are present, it could also disrupt sleep schedules by causing the person to wake up in the middle of the night just to urinate. So overall, it can be emotionally distressing, induce depression and anxiety.
In terms of approach, we use a feedback system that controls bladder contractions that's relative to your bladder size. Our group took our knowledge of natural neuroinhibitors like GABA, nerve signals, and muscle contraction to design a long-term implanted drug delivery system that will block the overactive signal propagation and inhibit muscle contraction until the desired pressure is met by an implanted force sensor. This will prevent random spasms and increase the quality of life for patients receiving this product. And to help visualize this approach, we created this diagram. And if we start with the condition on the left, an empty bladder will exhibit a low pressure and trigger the release of baclofen to prevent the overactivity and keep the detrusor wall muscle relaxed so the patient feels no urge. Then, when the bladder is full, the high pressure will surpass a threshold that causes the sensor to stop baclofen release so the detrusor wall muscle can contract and the patient can void.
Here we have an anatomical diagram of the bladder to better make sense of our system. So in the submucosa, which is that pink section, the wireless pressure sensor and the polypyrrole biomaterial will be implanted and connected by a wire to propagate the signals between them. The polypyrrole will continuously release baclofen, which is a muscle relaxer that has a short half-life and high bioactivity, and it would basically prevent involuntary detrusor contractions by relaxing the muscle. It also facilitates the binding of GABA receptors to GABA, which happens to be a neurotransmitter that relaxes the muscles. The pressure threshold that we will determine will be based on filling each patient's bladder to capacity to measure the submucosal pressure at that instant. This is a way to make our device personalized to each person so that it will detect the pressure at their specific bladder capacity. Once the threshold is reached, the baclofen will stop releasing, the muscle will contract, and the person will be able to urinate.
When designing our conducting polymer membrane, we chose a cost-effective polypyrrole to help make our product more affordable. Polypyrrole costs $94 per 10-gram pack from companies such as Millipore Sigma, and this is relatively cost-effective given its favorable biocompatibility and biofunctionality that ended up becoming integral parts of our design. In addition, there's the cost of baclofen, which can be as low as $1 per 50 milligram dose. And finally, we have our most design cost revolves around the surgical implant of our procedure. And it's also partially covered by insurance in most cases and can run up to $20,000.
Now, there are many solutions currently available to treat OAB. However, they fall short in a few aspects, for example, price and longevity. First, we have a Botox treatment, which lasts about 6 to 9 months and has an average cost of $800 to $900 per treatment. Secondly, we have neural implants on the sacral nerve, which proved to be a longer-term solution, going up to 15 years, but with a cost of $22,000, and a therapy cost that goes up to $14,000. Also, we have the pharmacologic therapy, which uses different substances like oxybutynin and trospium, with an average price of $700 annually and needs to be taken up to 3 times daily, depending on the patient. It is also important to mention that there are also even cheaper options like adult diapers. However, these are the most disrupted on the day-to-day life. Our approach hopes to provide many benefits to the patient as it aims to reduce the stress of taking daily medicaments and having to worry about the urges to urinate in undesirable occasions. We hope that with this approach, we can improve the mood, mental health, and overall well-being of the patients suffering from OAB and through the treatment process. And that's it. Thank you.